October, we've talked regular breast screening and early detection. We've talked about the right type of bra to wear, myths surrounding breast cancer, signs and symptoms, and a whole lot. There's a whole lot that we've discussed on most of our shows here in October. Well, October is dying out, and today probably will end our series on breast cancer. That's not to say we'll never discuss it, but of course, for the month of October, I think that today will probably be the last day that we'll be addressing or creating more awareness when it comes to breast cancer. But this morning, we want to dedicate some time to talk about the treatment of breast cancer. We've spoken to survivors, we've listened to their ordeals, we've listened to what they've gone through, what type of therapies they've had. But the experts are sitting here this morning to let us into exactly what the treatments for breast cancer are. Dr. Cassandra Odum, she's been a regular here this month of October. She's a general practitioner. But this morning, Na Ajoko Aite, she's also a clinical oncologist. She is here this morning to also take us through the treatment of breast cancer. Good morning, ladies.
Good morning.
I'm going to start with you today. Take a breather. Na Ajoko is here to do all the work this morning. I'm sure you'll come in as and when. Good morning and good to have you one more time.
Thank you.
So in our series, we've spoken to survivors, we've spoken to Dr. Cassie and a few other people. We've even had a live demo of how to do the screening.
I heard that.
You heard that, right? And the regular check of your breast. But one may ask, if I do not detect breast cancer early, once it's properly cancerous, and now I have to go through treatment, what's the best type of treatment for me?
That's a loaded question to answer.
I'm sorry.
The reason is that the treatment for breast cancer is a process.
Okay.
I always say that we are, as Ghanaians, we are used to, I have a disease, I take medicine for a number of days,
Right.
and I'm cured. But the treatment of breast cancer is not like that at all.
Oh, wow.
It's a process. And the first process is making sure that you do have breast cancer to start with.
Okay.
And so that they do a biopsy. I'm sure you've spoken about that already. Yes.
Dr. Cassie has taken us through that.
Right. Once we know that you have breast cancer, we also know that breast cancers are not the same. In fact, if you looked at the genetics of each person's breast cancer, they will be different. And there are certain specific things that we look for on each breast cancer cell to decide the kind of treatment to give.
Okay.
So the first thing is the kind of cancer that you have. The second thing is how advanced your cancer is. So the person who has cancer that is just 2 centimeters and has nothing in the armpit will have treatment that's different from somebody who has an ulcerated
cancer
breast.
is measured in centimeters?
It is.
Oh, to how bad it is or what stage you're at?
Exactly. And to estimate how long you would live, to decide what kind of treatment to give, things
so
like
2
that.
centimeters is probably stage what? 1?
It's T1.
T1.
Yes.
So what's T2?
T2 is when it's more 2 to 5 centimeters.
Ha. So it means T3 is above 5 centimeters.
Correct.
So that's when you have like how long to live?
It depends on what is happening in the armpit, and it depends on what is happening in the rest of the body. So there are nuances to it. They differ a little bit.
Okay. So in treating breast cancer, is the treatment for men different from that of women?
It is not. The important thing, like I said, is the type of breast cancer you have and the extent of disease, so the stage of breast cancer that you have.
Okay. So you mentioned that it's a process.
Yes.
So does it mean that there isn't one type of medicine or some dosage? Dr. Cassie, I think I can come to you with that one. Or some dosage you can just take maybe for 7 days. You know, when you have malaria, they'll tell you, okay, take this for 3 days or take this for 5 days and it should clear it out. Breast cancer is not treated like that?
No, so like she's saying, it depends on the stage at which you are presenting.
Right.
If you come and then the cancer is pretty small and hasn't spread from the breast, okay, then we may be able to do the treatment at the localized area and also provide radiation at that portion. But if the cancer has spread to other parts of the body, then the type of treatment you have will include the surgery and chemotherapy and possibly some radiation as well.
Okay. So thank you for mentioning surgery and chemotherapy. So we've heard it too many times, chemotherapy. Exactly what is chemotherapy, Dr. Aite?
So it's the feared word when it comes to cancer.
Very scary word.
I know. It's not that scary though.
It's not? Okay.
Explain. All right. So chemotherapy basically is medication that kills cells.
Okay.
Right. And the cancer cells grow very rapidly. And often they are not interested in correcting damage. So every cell can undergo damage. They will stop growing, repair the damage. And once the repair is done, they will go on and grow. But breast cancer cells are not interested in that. They are growing rapidly. They are not interested in repairing damage. What chemotherapy does is that it targets these rapidly dividing cells, so the cancer, and kills them, mainly because cancer is not interested in correcting damage.
Okay.
Right? The problem, though, is that in the human body, it isn't only breast cancer cells that are rapidly dividing. So there are other parts of your body that grow rapidly. Your hair follicles, they grow rapidly. The lining of your stomach, they grow rapidly. Your bone marrow, which produces your blood cells, they also grow rapidly. So when you give the chemotherapy agent, unfortunately, those other cells may also be damaged. The difference, though, is that they will take the time and make the corrections. That's the reason why when you stop taking chemotherapy, your hair grows back, your blood levels will come back to normal, and then the vomiting that occurs because the cells that line your gut are having some damage from the chemotherapy would also recover.
Okay, so I'm sure many people out there also want to understand what is in this chemotherapy and how long does it take, and why should my hair follicles fall out? Why must I feel nauseous all the time and I'm throwing up? What makes this whole change come to the body?
It's basically because of the death of the cells. If what keeps us balanced is that we have a constant number of cells that are growing and a constant number of cells that are dying. The chemotherapy will cause some of the cells to die quickly, more quickly than they would naturally. Okay. Right. But then, like I said, the normal cells will always recover, while the cancer cells will not.
So the effects of chemo, does it differ from person to person? Are there people who are able to retain their hair growth, or it's everyone would have to go through hair loss?
Most people.
So maybe 9 out of 10?
Maybe a little more than 9 out of 10.
So 7 out of 10?
More than that, more than 9. So it's nearing 100%.
Oh.
Yes. But the hair grows back. There are some...
How long does it take to grow back? So say I've seen photos, people say, oh, I'm a survivor, today is my last day of chemo, and you see them holding those papers with the photos and all that. So say today, I finish chemo, when do I expect my hair to grow back?
Our hair grows every day.
Okay.
Maximum in 6 weeks, you have some hair.
You should have something.
And it's a nice curly hair, I always say.
But it depends on the kind of hair also.
Oh, whatever your hair is, the one that comes after your chemo, it's like baby's hair. Oh. It's nice, curly. It's pretty nice.
Just like fresh hair.
Yes, exactly.
That's grown on a baby.
Regenerated hair.
Ah, okay. Doc, now let me come to you. You mentioned that that's a scary word that people do not want to hear when it comes to the treatment of cancer. Apart from your hair falling out and all that, what are the other side effects of chemotherapy? And secondly, we want to know this morning, is it painful?
Okay. So, like she was saying, it depends on the part of the body that it affects. Your bone marrow keeps growing, okay? So it affects the cells that make blood, okay, in the body. So you become anemic. It also affects the cells that help you fight infection. So you get recurrent infections. And then the cells that help you clot, okay, it affects those cells as well. So any cut, you bleed a lot, or you see any bruise on the skin. Okay, like she was also saying, because of the lining in the gut, you get diarrhea, you may get vomiting, some of them get dark skin and nails, some of them their nails break, okay. So the side effects is because of the drugs that you are receiving, and the reassurance is at the end of the treatment, all those cells will recover, and then you'll be back to normal. I won't say chemotherapy is painful, but It's given, okay, through a drip, the same way you receive a drip in the hospital. It's given through a vein. Some of them take it orally, okay. The side effects don't happen whilst they're in the hospital. It happens when they go home. So for that reason, they are put into support groups where they have nurses that they can reach out to speak to when they have challenges and then how to overcome them. And then there's also a psychologist, okay, who is part of the treatment, who helps them through the changes that they are going through, especially with their spousal relations as well. And then there's also a dietitian who helps them and teaches them what to eat, okay, because of the changes that they are going to go through. They are always nauseous, they don't want to eat anything. So all these people are there to guide them as to what to do to be able to overcome the period of the treatment.
So is that to say it's not painful in any way at all? I've seen videos and images where I see women laying on their stomach, and it's some type of radiation around the breast, and you're trying to say that is not painful at all?
Well, so that is different from chemotherapy.
What is that one?
Okay, so that is radiotherapy. Yes, so once you've had the surgery and we've given you chemotherapy, and the reason why we give chemo is that cancer doesn't stay in your breast. It goes to other parts of the body, correct? So by giving you the chemotherapy, it goes throughout your body, and the aim is that if there are any cancer cells elsewhere,
it starts to kill them.
It kills them, correct? Now, what radiotherapy does is that when we've removed the breasts or we've removed the cancer lump, we know that sometimes we don't take out everything. The reason is that some cancers might be microscopic, right? Meaning you can only see under a microscope.
You can't see with your own eyes.
Exactly.
Okay.
Sometimes they are a little too early that you may not even see it under the microscope. What the radiotherapy does is that if there are any such cancer cells there, it would kill them using high energy radiation.
Okay.
Yes.
And
so it's pretty much like a CT scan or an X-ray,
right, but
the energy is a little higher. Same thing, it destroys abnormal cells,
okay,
while the normal cells will usually recover.
So what's the degree of pain for radiotherapy?
It's not painful
at all.
It's just like
you don't even feel like
scan.
any heat or any type of fire or any sensation around the breast.
No,
none
people
at
say
all.
We are going to burn you. It's not painful. But
it's actually one of the myths out there. People
Yeah.
see it in videos and photos, and they actually feel that it is painful. I said,
No,
but
not at
it's
all.
it's not true.
It's not. We can have some side effects,
Okay.
right? Like skin changes. Sometimes you can have ulceration of the skin, usually superficial, and will heal in 4 or 5 days. That one can bend a little bit. But the best thing to do is to cover it, make sure you don't have any sunlight shining on it. Sometimes we use shea butter just to keep the area moist, and it really is not painful, much like doing a CT scan.
Okay, so let's say I've gone through chemotherapy or radiotherapy to get rid of breast cancer and all that. Is there a possibility of it coming back again if I've had it once?
I wish I could say no,
Oh
but the
my
answer
God.
is yes.
It could come back.
Yes.
Why? Family history, or because I've had it before? Why should it come back if I've gone through every treatment that I needed to go through?
Okay. So the first thing is that even if we have just one cell, one abnormal cell left anywhere in the body, given the right conditions, sometimes even after 25 years, it can go back. That's
Even
the
after
first thing.
25 years?
Yes. So we have patients who've been well for 25 years, 30 years, and then you find the cancer in the bone. The reason is that it may have been a cell that lodged somewhere. The body tried to control it, but then certain situations change, and then the cancer may go back. The second thing is that whatever it was that caused you to have the breast cancer in the first place has been exposed to the other breast, right? Correct. So in fact, it's the reason why people who've had breast cancer before have a slightly higher risk of developing another breast cancer.
one, yeah.
Because whatever was the reason for the first one, the other one has experienced it as well. And so you can develop cancer again. And then sometimes if the cancer is advanced, then it can metastasize, so spread to the other breast as well.
Wow. Very scary, but I believe there's hope at the end of the tunnel. Now, we want to get to when you have crossed over, when you've had radiotherapy, chemotherapy, and now you're well, what your lifestyle should be after you have survived cancer. But before we get to that, we hear the streets to pick your mind on what you think radiotherapy or the treatment for cancer is. And this is what she had to say. Let's take a look.
It's a viable option. And I did a little bit of research, and stem cells have proven quite effective in the treatment of quite a number of cancers.
Okay, so the little I know is that most cancers can be treated with chemotherapy, where they target the cancer cells and eradicate them from the system. That's basically what I know about treatment. So I think chemotherapy can also work for breast cancer if it's detected early, so that it doesn't get to difficult stages where it can affect other organs in the system.
Okay, so what I understand from my view is that you have to always come for regular checks for the lump to be detected. They will do something we call tissue incision, so that they can take out the tissue or the affected part, so that it doesn't affect the whole breast or for your breast to be removed or something like that.
As we all know, prevention, they say, is better than cure. In case one develops breast cancer, I would advise regular checkups will be done by the victim in order to know what exactly is wrong with the person. And moreover, if you go and you notice that there's something like that, the doctors will advise you on what to do and what not.
Well, so that's what she had to say on the streets of Accra. But one very important question that some women want to know. Women of childbearing age who have gone through radiotherapy and all that are asking, is it safe that after I've gone through treatment and I've survived, when I get pregnant, I have a baby, is it safe to breastfeed that baby?
Okay, so it depends on the kind of surgery you had, right?
Okay.
If all of the breast was removed, then that breast cannot be used. There's no breast
You can't
there.
use it, but if
so you can breastfeed the child on the other one.
It's safe?
Completely safe. Breast cancer is not contagious.
You cannot also transfer it to your baby
you
or
cannot,
anything
or
like
your
that.
partner or your friend. It's not.
It's not contagious.
Not at all.
Okay, so back to the very important one, life after survival. Dr. Odum, what would you advise that someone who's gone through chemotherapy and every other thing to survive, what must they do? Lifestyle changes, food, exercising and all that, do they count?
Okay, so most of them go back to their normal lifestyle after chemotherapy. The major issue they have is the psychological issue. They are depressed. Sometimes people become depressed and then tend to eat to overcome their depression, and then that tends to make them gain weight. And we know that you being obese or overweight, okay, it's also a risk factor for you developing breast cancer. So we advise that they should still keep healthy, okay, you should still engage in physical exercise, you should still eat the foods that would help you to gain your energy back, okay? Because of the radiation and the surgery and the tissues that have been lost, you have to eat foods that are high in fiber and then protein to help those cells, the area to regenerate, okay, so that the cells in that area will be fine. And then also we advise they take fruits and vegetables. Sometimes they say grapes because of the antioxidants in those kinds of foods, okay? So we teach them what to do to enable them to stay healthy during the period and prevent a recurrence. And like I was saying, the depression and the anxiety and then the fear of the cancer coming back is some of the things that they go through. So we advise them to see a psychologist who will take them through the process. And then also we want a family member who will be with them and also encourage them throughout the process. If they notice any changes at all, they always report back. And then they schedule them for follow-ups. Okay, they come where we look for any trace of the cancer recurring, and then we arrest it at that point of development.
Okay, so say I've had a mastectomy, one taking off, or probably all the two taking off. Dr. Ite, what are my options to regain my confidence? Can I go through reconstructive surgery? And if I can, what are my options? How expensive and all that?
It's been one of the best things that's happened to breast cancer patients. So these days we have plastic surgeons who are able to do reconstruction. They do it in two different ways. They can use your own tissue. Okay. So they can use some abdominal muscle, right, sometimes a bit of muscle from the back. and they can build a new breast for you, or they can put in an implant.
Okay.
And that's been, I wish I had brought pictures to show you. But you can actually see the smile on the patient's face
when they see that there's something that has grown back.
Correct. So it's a wonderful option, and it's available. I'm not certain about the price, but at the Kolebu Plastics, you can go and see your plastic surgeon and have a discussion. Yes.
But apart from reconstructive surgery, giving me other, new muscles and tissues and all that, what are my other options?
So we have breast prosthesis.
Okay.
So you would see somebody, and there are quite a number of women who are walking about with mounts on their chest. Your assumption is that it's a breast, probably not. So these are available to put in your brassiere. They have a nipple and everything, and they look like you have breasts.
Proper breast.
Correct.
But just that you have to take them off in the evening when you're going to. How long can you wear them for?
For as long as you want.
Okay.
Yes, because you put it in your bra just like, I don't know. You know, people already add stuff to their breasts.
I watched one lady right here on TV3. I think it was on Bella's show, and she says she's been wearing it for a very long time, and her husband doesn't even know that she's wearing something like that. Is it even possible?
I suppose.
I found that a little weird, because I mean, we're in the bedroom together and all that. So anyway, but at least there's hope. So you can go through either reconstructive surgery or have the prosthesis, like you have mentioned. Apart from these two, any other thing you can do?
There are women who go about without wearing any of these.
Okay.
For some women, right, they see their scar as victory. And so would choose not to wear anything at all. That's an option as well.
Now, when you've gone through chemotherapy, if you're a survivor and you get pregnant, are you assured of breast milk production? Does it affect it in any way?
The breast that receives radiotherapy, so sometimes we don't take out all of the breast, we take just the lump.
Right.
That one receives radiotherapy as part of the treatment. The evidence is that the milk that is produced is not as much as a breast that hasn't been irradiated, and the quality of the milk is not as good as the one that hasn't been irradiated. But you can give both. It's not as though there's anything bad in it. It's just that if you give it on the breast that has been treated, you need to supplement it with the breast that hasn't been treated, so that the quality and quantity.
Of course, you've mentioned
good.
that it's not contagious, it's not transferable, so the baby should be safe.
Yes.
Wow. Your last words before we wrap up on our series on breast cancer, Dr. Odum.
So we keep saying that early detection is a lifesaver.
That's the major key.
Yes. The earlier you come, the better the outcome of treatment. So October is not over yet. If you still haven't had your breast screened, kindly walk into any health facility to get your breast screened.
Dr. Tete, what would you tell all the women out there? There are so many people who are afraid, even to go for the screening. The last time I came for screening, I was like, hey, what if something is found? What does it mean? What's going to happen to me? There are so many people in this position, and just because of fear, they don't even want to go for screening. What would you tell them?
So the truth is that the earlier we find your treatment, the more likely it is that we will cure you. And by cure, we mean the cancer will not come back.
Okay.
The bigger your cancer is, the more likely it is that it's gone elsewhere in your body. Then the treatment becomes difficult, it becomes expensive, the side effects are a lot more. So let's find your cancer early. And I want everybody to know that the treatment is different for every single person. So don't rely on somebody's story. It may not be your story. Yes.
All right, Dr. Cassandra Odum, she's a general practitioner. She's actually been here all through the month of October. We appreciate you so much. Thank you for everything that you have taught us in creating awareness for breast cancer. And of course, this morning again, Dr. Na Ajoko Aite, clinical oncologist, also giving us her 2 cents on what you should do to prevent breast cancer. I've said it before, death is inevitable, but if you can do everything in your power to make sure that you do not die from breast cancer, you must do it. It's the 27th of October. We are still in October. Make sure that you get screened, because early detection would actually save you. Thank you so much for watching. This is still TV3 New Day. Bella's coming up with a discussion.